Hi there, I'm Dr. Ryan Smith, an anesthesiologist working with many of Ortho-SC's joint replacement patients. I'd like to take a few minutes to discuss the approach that we typically take from an anesthesia standpoint for hip and knee replacement. When most people think of anesthesia, they think of general anesthesia, a state where we render patients unconscious for the duration of a surgery. This is a very deep level of sedation that requires anesthesia providers to maintain vital functions for patients. General anesthesia is very reliable and quite safe, but it can have downsides for some patients, including nausea and slow awakening. Another anesthesia option for hip and knee replacements is called spinal anesthesia. This is a technique in which we introduce some numbing medicine into your lower back, resulting in a temporary numbness of the nerves that travel to your legs for roughly 3 to 3.5 hours. During this period of numbness, your anesthesia providers give you intravenous medicine to make you sedated. This sedation generally results in you not having any awareness or recollection of the surgery itself, similar to the sedation one might receive during a colonoscopy procedure. The advantages to a spinal anesthetic are numerous. Patients awaken from the intravenous sedation much more quickly than they do from general anesthesia, and they generally feel more alert and clear-headed sooner. Plus, the numbness from the spinal anesthetic tends to linger for approximately 1 to 1.5 hours after the surgery, meaning that patients awaken with much less discomfort than from a general anesthetic. Last but not least, studies have shown that patients who undergo hip or knee replacement under spinal anesthesia have a lower risk for blood clots and for infection at the surgery site than those who have the same surgery under a general anesthetic. Having said all that, there are some patients who will either prefer general anesthesia or who may not be good candidates for spinal anesthesia. In those situations, your anesthesia team can certainly provide a safe and effective alternative to spinal anesthesia. As always, we will discuss all of your concerns prior to surgery to make sure that you're fully informed and can make the best decision for you. On behalf of your surgeon and the entire surgical care team, we look forward to taking great care of you.